I'm here with Debbie Kantor, an amazing client of ours and an inventor. Welcome, Debbie. It's such a pleasure to have you here.
Thank you, John. I appreciate it.
So I'll start just by tell us a little bit about yourself before this idea came to you. I mean, no one's born an inventor, so a lot of times they have a day job and they're doing something many times related to their idea, sometimes not. So what's your story before the idea got you?
Yeah, my background, I'm a nurse practitioner. I was trained at the University of Pennsylvania as a gerontological nurse practitioner for older adults primarily. I also sat on the clinical faculty for about 6 years, teaching head to toe physical exam for patients of all ages. But I've also worked in a variety of settings. Home health care, where I would go into people's homes, conduct assessments for them, treat them. And most recently, I had been working in a Humana-based primary care clinic for older adults. Essentially synthesized over 20 years of experience as a nurse practitioner, along with some needs to care for my own child with some complex needs. And I realized a significant gap in care, primarily for a cap-shaped dressing. That was my aha moment initially.
So this is something, in your case, like a lot of inventors, your normal day job led you to find something was lacking in the field. So tell us, how did the idea actually come about from seeing this need?
Yeah, so I had heard that typically there's one moment that gives you a realization. In my case, I was conducting an exam on an older woman who was living on her own with blindness from diabetes and an amputated leg. And while I was in her home to conduct a specific exam, she asked me if I could change her dressing on her stump. She had an infected wound. And so I offered to help her out, and I realized when she pointed to a bag full of, wound care dressings that she had to buy on her own at Walgreens or wherever, I realized that there was no good dressing, even for a nurse practitioner who's trained in wound care, to help apply. And of course, a patient, with vision loss, mobility impairments, certainly could not apply it for herself. So at that moment, I'm squatting on the floor in her apartment with a bag full of materials, and I realized there has to be a better way. Why can't you have one bandage that's cap-shaped to fit over a stump dressing that would just easily, in a matter of seconds, be able to be placed instead of having to take square and rectangular and rolled gauze and put them all together. And so that was the moment, probably pre-2015, when I first thought of the idea.
So it's not just the patients themselves that were having to do this, but even in healthcare settings, even in hospitals, you didn't find any kind of solution that had the shape of this bandage, like cap-shaped already.
Correct. All bandages in healthcare either come in a flat format or rolled like typical rolled gauze. And so I realized we haven't really changed, even with advanced wound care dressings made of different materials, we haven't updated or advanced how we manage specifically cap-shaped anatomy when we need wound dressings. And so once I had that moment, I started thinking about every body part that could use a cap-shaped dressing, not just an amputated stump, fingers and toes, and of course a head dressing because of the issue with, scalp lacerations, bumps to the head, traumatic brain injury.
Okay. And at which point, now tell us a little bit about your prototyping. Did you, it's rare, but sometimes an inventor gets it right on their first attempt. Most of the time, however, it's a long process of trial and error while they're trying to figure out what works best.
Yeah, this has been a few years in the making in terms of prototyping. I've experimented with so many different materials that actually started off just with a diaper. And I really thought, well, it's really just a diaper with no leg holes. We need something absorbent, we need something fitted. And so initially I was cutting out diapers and adult undergarments, and then it evolved to, playing around with different ACE bandages, elastic materials. And so we've worked with a number of development firms, and now over the years, I've circled back to thinking about diapers and undergarments, and I actually have a former head of R&D for Johnson & Johnson on the consumer side, who I believe helped develop the diaper for NASA, and he's now helping us source materials and make the final design for it. So it's taken a lot of different experimentation and iterations.
Now you got a lot of early interest in the concept, right? So tell us a bunch of awards. So I know, in fact, you mentioned Johnson & Johnson. They had a quick fire challenge that you won and some other awards. Tell us about those and where the product is being used now.
Yeah, so first of all, we're still pre-sales. We're at our design freeze now and probably a few months out from manufacturing. But the interest started we joined the Mayo Clinic Life Sciences Incubator in Jacksonville, Florida. And, it was basically a shared office space. We received some mentorship. I was matched up with a neurologist, Dr. Freeman, who I'm still collaborating with now. During that time, I submitted a pitch to Johnson & Johnson Quick Fire Challenge. Provided the link by one of my senior advisors, Tom Dugan, who was former president of Smith & Nephew Wound Care. So he knows the industry very well. He said, look at this pitch to Johnson & Johnson. This would be great for you. And so I submitted and not expecting to hear back, had the opportunity to pitch, received $50,000 as prize money. And with that came a year's worth of mentorship, webinars through J&J, and it did help open a lot of doors. And, with that, we were actually able to conduct our first feasibility study at the Mayo Clinic. And we took one of our first prototypes here.
Wow.
It's our cap-shaped bandage, has the absorbent core on the inside, a stretchable, nice compressive bandage. And with the funds from Johnson & Johnson, it was able to help us do a test where we had two patient actors, male and female. And on a walk-in basis, we had clinicians, surgeons, surgical nurses from the neurosurgical unit at Mayo Clinic on a walk-in basis test our bandage versus standard of care. And we ran it as a time trial. And what we found was the clinicians were very interested. They had never seen our bandage before. And still, our bandage was 3 times faster to apply than standard gauze, even though they were used to it, did it 10 times a day for post-surgical dressings. And so that gave us tremendous validation that we were onto something.
Wow. And that's the biggest social impact award. That's relatively recent. So tell us about that and how that came about.
Yeah, so this was another Johnson & Johnson sponsored event through M2D2 at UMass Lowell. They run 10 to 12 week accelerator program for medtech companies. I was one of 12 companies to pitch at this event last week. And, they handed out a few prizes and we received 2 of the prizes. One was the biggest social impact, and that was by popular vote of the, 50 or 60 people who were mostly investors, other people in the med tech field who were voting after I presented a 4-minute pitch. Judges on the panel were also voting, and it was specifically for wound care med tech products. And, I'm thankful. I know that we're working on something that has the potential to save lives by providing a faster emergency care solution. So that was one of the nice prizes sponsored by Alira Health, a Boston consulting firm. And we also received an award called Next Level, which meant that we were chosen to be the company most likely to take our idea to the next level. And so with that, I received a month's worth of free coaching from a firm.
Wow. So you're in a great position with a lot of mentoring, a lot of coaching. And for many of my clients, the funding part is a huge challenge. You want to talk about that a bit? I know the original win of the Johnson & Johnson Quickfire Challenge helped with initial funding, but tell us about the journey since then.
Yeah, we are still, I'll say, struggling or challenged by raising a convertible note round. We're raising $1.4 million right now. Of course, COVID threw a wrench in funding with the economy. We took that as an opportunity, though, to work on data validation, conduct research. And although we haven't pulled in the money for funding that we have wanted to yet, and it's been mostly self-funded, I've also continued the circuit of pitching. I've traveled to Texas A&M. I've received, some non-dilutive funding, actually funded by an FDA consortium through Baylor College of Medicine and the Southwest Pediatric Device Consortium. So I found alternate routes for smaller amounts of non-dilutive funding while I continue to pitch to investors. What I found is that we tend to be early for many of the companies through the VA and the government. I was actually told I was too advanced for one pitch event, which I was shocked by. Yeah, and every time we either receive another award or conduct another feasibility study, it's provided good validation that I can then report to the companies that I've been speaking with. So it's a lot of just reaching out, throwing myself outside what I thought was my comfort zone and speaking to more and more people.
And you've had a lot of success, and that's great to see. I want to know about some of the obstacles and struggles. Were there low periods where you even doubted, should I throw in the towel? Should I give up? What were the biggest obstacles you faced, or the dark moments, so to speak, in your journey?
Yeah, and I'm sure I share this with many founders. There are always dark moments. This journey is really, truly a lot of bumps in the road. Every time, take another debt of $25,000 personally to invest to help pay for, whatever it is, business-wise, to help with the prototype, for patent fees, whatever it is. It can be hard to swallow, and you think, well, I had a day job as a nurse practitioner. That was fantastic. I had a great salary and I knew I was helping people. I do have the potential to help so many more people this way. And so that's what drives me, is knowing that I am making an impact, and I receive that validation every time I speak with people. And so I know that I won't stop. I need to continue with this. And I try to speak with as many founders who are a few steps ahead of me. And I have found that other medtech founders are extremely open to discussion. Bouncing ideas, picking their brain has been very, very helpful for me.
I know you have 2 granted patents and international protection underway as well. Were there any obstacles in getting your patents granted?
I think the obstacles, well, are funding. Of course, I would love to file more patents than what I have now. I'm limited by that. There's always a question of which country to file for. Do you continue the review process? At what point do you, like you said, throw in the towel on a certain element and say, okay, I really need to pick and choose. And so I am thankful your team has helped educate me on that. I've spoken many times to members of your team, and I've been extraordinarily confused by the process, just because it's not my background. And so I appreciate the patience to help walk me through the process. Again, it's, I'm having to learn the business side of startup life, how to model out my financials, how to prepare a pitch deck, what the go-to strategy is, the IP. And so I'm having to be, I'll say, a point guard in basketball, but without having all that knowledge that I need. So
and
the
a lot
guidance.
of this, you say outside your comfort zone. As a nurse practitioner, none of this is normally in your wheelhouse. Have you ever thought of yourself as an inventor before coming up with this idea?
I'll tell you a story about when I tried to be an inventor. And this would have been 1999, 2000. And I had just, my daughter was born, and I was working 2 nurse practitioner jobs, and I wasn't sleeping. And I don't know if it was part delirium or just nervous energy that made me need to create something else. And so I decided that I would invent something. I didn't have the means to hire an attorney. I was living in Philadelphia at the time. And I decided that I needed to invent a cup that had, for drink, a beverage cup that had a snack on top. And without having an attorney to help me file it because of my lack of funds, I decided to file it on my own. You can look up my patent and laugh at it because it's been cited a number of times, and fast forward, a number of years, I'm sure you've seen the products Snack Ease and Walgreens and Rite Aid. I'd like to credit myself on that initial idea, but when I did try to submit the final, non-provisional patent, I received a nasty gram from the USPTO. I shouldn't say that publicly. They laughed at me and they said, don't try doing this without an IP attorney, essentially. And so I learned my lesson, that as much as I thought I had a great idea, you have to do it the right way. Which meant for me, it meant waiting 15 years until I had the funds and a much better idea. Could I have made, a quick buck on that idea? Probably. But I feel much better now having waited and doing something that's actually a social impact for patients. So, it was a good learning lesson for me.
Yeah. And I love the fact that you're so passionate about your current idea, and it ties in with your, there's not this big discrepancy between your work as a nurse practitioner and the idea, because that work is what exposed you to the need for this. So that's always an interesting part of the journey. What would you say is the most rewarding part of the inventing process for you?
The most rewarding process, I would have to say, meeting all the people along the way. My father is 88 going on 89, and he's always said, life is with people. And he said that so many times, I'd say, yeah, of course it's with people. But I've taken that to heart, that really it's the people I've met along the way. And I've really enjoyed speaking with everyone from all different backgrounds, spoken with a lot of veterans, whether they were patients of my own who shared anecdotal stories, other inventors. I've listened even to, there's a great podcast by Guy Raz who talks to all these entrepreneurs, and I've listened to so many people's stories. It's rewarding for me to know that I'm giving it my best shot, and that if I don't do it, I don't know if someone else will. And so, I feel like almost a social obligation to help out. And what I didn't share before is that, the reason why I switched from the idea of just a stump bandage to a head bandage was for a very personal experience back after my daughter required brain surgery at one of the top hospitals in Philadelphia. We had to rush her back to the hospital. And, they don't typically monitor people after neurosurgery. It's not like a cardiac surgery. And so as we were taking her back to the hospital, there happened to be a school shooting in rural Pennsylvania a number of years ago. And at the same time that we were taking my daughter in, these girls were being airlifted. And I realized, thinking back on that moment, that had there been a better solution to put on a cap-shaped bandage onto each and every child that was monitoring vital signs for them, we'd have such a better solution and faster way to understand the severity of these children and help manage the resources in the hospital. Because I remember the nurses just being so overwhelmed and not knowing where to start. It was just much more chaos than they anticipated. I mean, ERs, of course, are ready for that. But in terms of social impact and making me feel like I'm doing my job as a nurse and a citizen, it's knowing that I could help potentially in some of those, mass casualty events.
More like a triage function, you're thinking, so the nurse practitioners, the medical personnel can tell, okay, which patients do we don't have the resources to help everybody right now, so they have tough choices to make, like which ones should
Right.
be addressed immediately.
Exactly. Yeah. And so what we have, and of course, my son has been our biggest, he's been my computer scientist and engineer right now. He's 19 at Georgia Tech. And, due to limited funds for development, I've leaned on him. He was able to build this for me in time to present to the Department of Defense. So, I'm speaking with various groups related to warfighter brain health to discuss the use of our technology for triage in the battlefield, mass casualty for civilian as well. But the idea would be not in this format, but what our second patent relates to is having integrated sensors that communicate with a mobile app. And so the goal would be, could take a photo of the patient, use some analytics, and actually have the vital signs pulled in from the sensors here and connect. And we're using data science at the back end to help understand the severity of patients. Right away, we would know, okay, an older adult is at a higher risk, let's say, than a 25-year-old because they're more likely to be on aspirin. And so we've taken a very simple cap-shaped bandage and used very sophisticated analytics to start to understand how to best triage the patients.
Yeah, oh, that's amazing. I'm excited for the current state, but do you have anything that you want or can talk about future ideas or changes? And of course, as a patent attorney, anything unprotected, I have to advise not to talk about that. So,
right.
What's in store? Is there stuff in store going forward as well?
Yeah, so in store going forward, eventually we're creating a platform that's not just focused on head injury. We are using analytics to look at things like pain as well. That's obviously a massive problem with the opioid epidemic. But we're starting initially along the same lines of traumatic brain injury because so many patients with TBI, head injury, end up with chronic pain. So specifically, we're looking at that and using data science to help understand that.
Okay, I know for a lot of inventors, you're such an inspiration and your story is inspirational. Do you have any advice for somebody that's early in the journey? Or perhaps an inventor that's on the fence and not sure if they should go forward or not. Like, what advice would you give your younger self that you've learned the hard way, things that you would do differently, perhaps?
Yeah, I was asked that recently. And on one hand, I would do everything different. On the other hand, I wouldn't do anything different. The one thing that really held me back was financing to file for the patent. I think the point at which you can decide that you believe in yourself and you're ready to take that leap, I would do it. I do think that, and I've told other inventors that filing the IP is one of the most critical steps. That needs to be done. I've seen that when I pitch to investors. They very much want to know, well, what IP do you have? That's one of the first questions that they ask. And so before you spend time prototyping and creating something, rather spend the money on the IP, even if it's for a provisional patent, at least to set the stage that you're starting to have some IP in place. And really look very critically about how is yours different. Because a lot of people, also investors, they will search and look for any other products that might be similar. And so to be able to explain that well, one of our biggest things is, well, can't you just use gauze? And you wouldn't have needed to file for all this IP. And I say, well, yes, but it's inefficient, it's ineffective. And so really studying the failures of the standard of care or the standard process if it's not medical. You really need to know that very, very well.
So Debbie, I know we've spoken a lot about you and your journey, and you've had a lot of coaches and mentors as well. but have there been others that have been instrumental to you getting where you are?
Yes, absolutely. I recognize I can't do this by myself. On a day-to-day, I'm not funded to hire the people I would like, but it's been extremely validating to me that I have advisors who are sharing this journey with me. I have Tom Dugan, who is president of Smith & Nephew. He's been in the medical device industry for 40 years, and that provides tremendous credibility for me. I have a medical director, Mike Blivis, who helped pioneer ultrasound technology. He's an ER physician with hundreds of publications on digital health. And so, I also have an urgent care physician who's been by my side as a mentor and friend, Dr. Madhavi Reddy. Amit Vora is a serial entrepreneur I have, out in Silicon Valley, who just brought his mobile MRI machine to market. I've had incredible people who really understand my mission and are helping guide me. I have a regulatory advisor out of Boston, Vicky Anastasi, who's amazing and has helped get brain technology to market through the FDA, medical sales, and Colin Rubel. And so I really see that I need each and every sector to help even plan, whether it's planning IP, planning direction of the company. So you can be an inventor as a solo person, but to try to go from inventor to entrepreneur, it takes a team. So I'm very thankful to have people around me.
Looks like you compiled quite the team, and that's something investors are looking for as well, right? They want to see if you have the right team behind the idea, in addition to having a phenomenal idea and having the IP protected.
Yes, and it becomes a bit of the chicken and egg battle, because without funding, it's hard to build a team. And so we've had to be scrappy, capital efficient, however you want to call it, allocate stock options or have volunteers. But it makes it harder to bring on a team. I'd love to have engineers in-house. So really having people who believe in you and the mission and are willing to take that chance, connect their name to it, has been incredible. And all these programs, accelerator programs, through the Johnson & Johnson M2D2 program. I have an R&D director from Ethicon who's a mentor. I have a wonderful serial entrepreneur, Nancy Briefs, who's started and exited numerous companies. And so having that guidance has just been incredible for me.
Debbie, talk to us a little bit about the early days and the founding of the company.
Yeah, so I founded the company Hero Medical Technologies with my partner, co-inventor Sharon Whiteman, who's my wife. She was a Navy lieutenant through the Australian Royal Navy. She served also at U.S. Naval Station Mayport and was in charge of logistics support after the Haiti earthquake. And so her background is really humanitarian aid, logistics supply. And with my background as a nurse practitioner in healthcare, we really were able to merge our expertise in creating our medical solutions. So really what we're going after is expedited delivery of care for emergencies. And so it really takes her naval military expertise. She also has a background in software and sales, worked with a startup that sold to GE. And so it was a great way to merge both of our experiences to help deliver efficient care.
Oh, terrific. And you're both bringing completely different aspects of experience to the idea. Which I'm
Absolutely. Sure. Definitely yin and yang. Yeah.
Well, that is phenomenal advice, Debbie. I want to thank you so much for being here and sharing from your wisdom and about your journey.
Thank you, John, because I appreciate you helping me take this exciting ride. And with 2 patents, I never thought I'd be here. So that's wonderful.
And more to come.
Yeah, thank you.